Now at 4, your community focus, we're talking COVID-19 today with Dr. Jim McDonald from the Rhode Island Department of Health.
And what a day to have him live. He joins us live every week on 12 News Now at 4. Thanks for being with us, Doctor.
Ryan and Kim, it's great to be with you. I'm live from my front porch today. It's such a nice day to be outside. I said, hey, why not join Brian and Kim from my front porch today? So welcome to the McDonald home today.
Thank you. It's certainly a great day to be outside, but some of the major news that we learned about today regards indoor mask wearing. The CDC announcing today that fully vaccinated people no longer have to wear their masks indoors, aside from very crowded places. But Rhode Island hasn't updated its mask-wearing policies just yet. So when do you think that might happen?
Yeah, we need time. Like the governor said this afternoon, we need to look at that, what the CD said, and then make some recommendations to the governor. You know, I'm actually meeting with some of the other physicians from the Department of Health at 5 o'clock tonight to discuss it. You know, it's interesting. It makes sense, though, because the larger message is this. If you're fully vaccinated, you really aren't at risk of getting the disease, a really effective vaccine. But more importantly, you're not really at risk of transmitting the disease. And that's something that we didn't know where the science was when we first started vaccinating people back in December. But we do know where it is now. And it's just another reason, if you haven't had a chance to get the vaccine yet, I know people are busy, this is a good time to go get the vaccine. And we're ready to give it to you.
I think one of the big questions that people have, we've been seeing this on social media, how are people going to prove that they are fully vaccinated? You might be in a setting where you see someone without a mask. I don't know whether or not that person has been fully vaccinated. How are we going to avoid that potential conflict between people and make sure that the people who aren't wearing their masks are fully vaccinated?
Yeah, it's the right question, and really the details have to be worked out a little bit. You know, I actually carry a digital image on my phone, but I really hope I'm not being asked to produce it every 5 minutes for people. You know, the honor system has worked pretty well in Rhode Island for a lot of things. My guess is that's where it's going to be, but we'll see. Individual businesses and other agencies are going to do what they're going to do. There might be a way to check as people come into a building. We'll have to wait and see. Those details still need to be worked out.
And Dr. M, you said you're meeting tonight, I believe you said, in just about 20 minutes to talk about this. Do you think we could see a change in guidance as soon as tonight or tomorrow?
I don't think it's going to be tonight, but I do think that we're going to work on this as quickly as we can. Obviously, it's important. You know, when the CDC makes a national recommendation like this in a pandemic that's been going on for 15 months, people want to hear what's going on. Keep in mind, though, the Rhode Island Department of Health, we're your doctor. The CDC has to make recommendations from the Northern Marianas to Northern Maine. They don't know our local data like we do, so we have to look at our local data and what makes the most sense to keep Rhode Island safe, but also out there doing what they need to do. So we're going to look at it tonight and hopefully get some information to you soon.
Dr. McDonald, we'll stay tuned for that, of course. The other big news that came out this week was that the vaccine is available and approved for 12 to 15-year-olds. Wondering if you can explain some of the difference in the approval process for the younger age group. Monday, we heard approval from the FDA. Yesterday, it was then the CDC. Explain the process for us for any folks who are still hesitant to have their kids vaccinated. Is there any other hurdle they should be waiting for to feel more comfortable?
Yeah, no other hurdles to come. So one, it's the same Pfizer vaccine adults are getting, same dose, same 3-week period. The Food and Drug Administration, they're the ones who actually grant the emergency use authorization. So once that was granted, Rhode Island said, let's go ahead and give it. The Advisory Committee on Immunization Practices recommends to the Center for Disease Control any fine nuances. They had their meeting yesterday, and then the CDC came out and gave little tailored recommendations. There were no big changes, and nothing was expected in that regard, like in previous vaccine announcements. That's part of Rhode Island. We went right ahead and get started on that Tuesday morning.
In terms of vaccines for kids, we know kids under 12 still not authorized to get the shot. Does that mean that they're going to have to continue to wear their masks well past when their parents can take them off?
Yeah, unfortunately it does. I mean, the mask mandate is really about who can transmit disease and who's going to acquire disease. So at this point, the unvaccinated, no matter what their age is, will still need a mask. Of course, we don't want masks in anyone under 2 years old. That's not something we do. But for kids 2 to 12, they're still going to need to wear a mask. But, you know, I sense that approval for the vaccine 2 to 12 is coming out later in this summer. I'm hearing August, September. We'll have to wait and see what that looks like.
I wanted to ask you also about vaccine side effects. We've been hearing a wide array of things from folks. Some people just get a sore arm. Other people spike a major fever. Is there any sense of why this impacts people so differently, or steps folks can take to try to avoid feeling run down?
Yeah, why it affects people differently is you're all different. And that's on you, my friends. And I like you guys being different, by the way. And it really is just your body responding to the vaccine. Nothing to be worried about. It's kind of interesting. The 3 McDonald children got their second dose of vaccine this week. One had a fever, one was tired, and one just had a sore left arm. So there you go. I had 3 kids with 3 different reactions, and today they're all just fine and dandy, all working and happy.
Dr. McDonald from the Department of Health on a very big day. Lots of announcements. We appreciate your insight tonight.
Thank you, guys. And don't forget, Rhode Island, wear your sunscreen.
Always sage advice. All right, Dr. M, thanks. And coming up in tomorrow's Community Focus, UMass Dartmouth's interim chancellor, Dr. Mark Fuller, will be joining us to talk about the COVID impacts on colleges and Instant Decision Day this weekend. That's coming up tomorrow in your Community Focus.